Hello, my name is Sarah-Jane Marsh and I'm the Chief Executive of Birmingham Women's and Children's Hospital, incorporating Forward Thinking Birmingham.
Sarah-Jane, thank you very much for joining me for Inside West Mids.
You're welcome.
Just if I can ask, what's your journey been like becoming the CEO of Children's and Women's Hospital?
Yeah, I've worked in the NHS now for 19 years and I joined it via a graduate management training scheme. So I came in and worked at various different places, in hospitals, with GPs, in community services, and then I got my first job at the Department of Health. Then I worked at Walsall hospitals. I've worked in all different sorts of roles, in planning, in operations, and I became a chief exec 10 years ago. It's just been the most amazing journey and experience. I mean, working in healthcare is a real privilege. I guess the thing that's marks it out for me is really trying your best really hard every day to make things better for the staff who work in services and the patients that you're looking after. You know, I've got lots of different experiences in my career, but they always come back down to that, really, remembering what you're there for. I think young people could be in leadership positions, you know, from a very early age. I think we've got too much of a thing that experience is based on how many years service you've got in something. And actually the young people I work with have often got the most sensible ideas about everything. Right. So my advice would be to approach everything with passion. Choose the jobs that you do because it aligns with it aligns with your values, it aligns with the things that you want to do every day. When you're doing work that you enjoy, that makes a difference, that's meaningful, where you're surrounded by people who inspire you, that's when you're going to shine, that's when people are going to notice you, that's when you're going to make a difference. So that would be my big advice, so just enjoy what you do and really put all your passion into it. If you don't enjoy going to work every day, then you've got the wrong job, you need to think about doing something different. Part of the graduate scheme, before you start your first job, you have 3 months in what's called an orientation period where you spend time in all different areas of the NHS, and it really makes you understand how it goes round. So it's not just the things that you know about, you see all the clinical support services, things like the laboratories, the mortuary, the kitchens, and how important getting the food to the right place at the right time is, all of the services out in the community done by district nurses, school nurses, speech and language therapy. So it really makes you think, actually, don't just take perception, don't just look at what's written on a piece of paper or in a report. You have to get out there and really sort of look at all of the services. So it's been ingrained in me from the very beginning. But I also feel sad might be the best word to say. If a couple of days go by and I haven't done that, I've been sort of constrained, so I've had to do meetings or whatever. I think I'm going to have to go somewhere. I'm going to have to remember that I'm, you know, in a hospital or in a community setting. I'm not an administrator. So that's one of the reasons that I wouldn't want to go and work anywhere else, because you can just be in the heart of the service talking to staff, patients, families within a couple of minutes, and that's just so important to me and my leadership.
Wow, perfect. No, that's been amazing. Thank you.